Impetigo. Impetigo is so common in young kids, and you're far more likely to see an atypical presentation of impetigo than some weird, unusual skin disorder. Impetigo presents in many different forms. So classically, it's erythema, sort of around the nose and mouth and hands, and you can have that sort of honey crusting, but it can look like anything. It can be sort of look like a little bit of a tinea infection. It can be just sort of a macule or papule. Think about it, if you have a patient that has lesions on the mouth, face, hands, and it spreads along their body or spreads to another child at home or among the preschool, very common. It can be caused by both staph and strep. Bullous impetigo tends to be staph, and non-bullous can be either. It's very common, very infectious, associated with young kids. My children had this many times together, and really the treatment is prevention, good hygiene, washing your hands, don't share the same towels, and then topical therapy for most cases is sufficient. If it's really extensive, involves multiple body parts, then you may need oral therapy. You can theoretically get post-streptococcal glomerulonephritis. This is not prevented, unfortunately, by treatment, but it can be a potential sequelae. Here's a picture of impetigo. This is a little bit more classic. It's crusting. You wouldn't miss that diagnosis. Here's another photo. Just some papules around the nose, mouth, face, hands, very common locations. Just to put these two side to side, here's erythematous, well-demarcated edematous erysipelas with impetigo. Again, remember, impetigo can look many different ways, so the history is really important. If it's on the nose, face, mouth, hands, spread amongst family members, treat for impetigo.